Just deep breath. Good. Good all the way out. Perfect. Awesome. Good. Beautiful. Awesome. Just going to contact here, roll them over. Perfect. Good. Awesome. What's up, guys? Dr. Drew here, back on the page. Thanks you for watching this video. If you guys have not seen our videos before, make sure you hit that like and subscribe button. Today I'm here with Joe. He's a new patient with us, about 2 weeks into his current treatment plan. Joe came in with lower back pain, was seen by a previous chiropractor about a year ago, was hitting a plateau, reached out to us. We were able to take his x-rays, analyze that his hip was off, a little bit of a curvature in his lumbar spine. Recently had a new baby, so congratulations again. Also an avid golfer. He's about a 3 or 4 handicap from what I remember us speaking about. But I'm gonna let Joe just tell you guys a little bit about himself, how he found us, what we do in the office, what's worked so far in treatment, and then from there we're gonna go ahead and get adjusted. So Joe, just tell the viewers, like I said, a little bit about yourself, what we do here in the office, how you found us, things that you like, and kind of go from there.
My name's Joe. I work in sales. I was driving home from work and saw these guys on the side of the road and decided to reach out and see what they could do for me. So I've been coming here, like Doc said, for about 2 weeks. Things are feeling a little bit better and feel like I'm progressing a little bit more so than I had done before.
Yeah, so Joel's main goal here is, one, be able to interact with this child, okay, not be limited, whether it's picking up the baby, bending, lifting, moving, whatever it is. Obviously, two, want to make sure that he's, again, not injuring himself or causing him pain when he is golfing. And then three, obviously just go through his day-to-day life with work, that corporate lifestyle of sitting repetitively and be able to maintain that. So that's our end goal. This is our first video. We'll do a follow-up video at the end. But thank you for watching this video, guys. If you guys have any questions or concerns, again, please hit that like and subscribe button. It truly helps us out. Without further ado, we're going to go ahead and get Joe adjusted. All right, guys, first thing we're going to do is warm up the spine here with our Hypervolt. Got this new attachment. We call it the double barrel. If there's a correct name for it, leave it in the comments below, because I actually don't know what the correct name for this attachment is. But again, what we're going to do is just warm up the paraspinals. Those are the muscles parallel to the spine. Just engaging those areas, especially after a long day of work. Midway through the week here. Big stretch for Joe. Just deep breath. Good. Just allow your body to relax in that table. Good. All right. We're going to start by adjusting this mid back here. You're going to hear popping and cracking, so deep breath in. Good all the way out. Perfect. Awesome. All right. Relax this left shoulder. Good. Beautiful. Awesome. How was that?
Good.
All right. So we're going to have you laying your left side, Joe. Face me. Perfect. We're going to adjust Joe's right SI, sacroiliac joint, in his lumbar spine here. So again, I'm just going to contact here, roll them over. Perfect. Good. Other side. Hydration's been good?
Yep.
How's your sleep been? Getting better? Waking up? Feeling better?
Yeah, definitely.
Good. Have you swung the club yet?
A little bit in the simulator.
Awesome. Good. On your back. Stretch here. Awesome. Come on up, Joe. Great job.
Thank you.
So guys, don't forget, we also just put out a new golf series for all of you golfers, a warm-up series, a post-round series, anything like that we see as far as patients coming in, some of the injuries that they have. So if you guys want more information, click on our Facebook, click on our Instagram, click on our YouTube page. The links are all there. But again, thanks for watching this video. We'll see you guys in the next one.